Hello Bernd, go for it. We want to show a nice case.
Yes, not the catch of the day, the case of the day. I think it's an interesting case. This patient was referred from another doctor, and you see on the mandibular left side we have a huge defect. There was a big cyst, and now we want to use a bone ring technique to compensate this defect and to insert simultaneously in an implant. You see, after raising the flap, the geometry from the defect is like that we have no buccal bone and we have no lingual bone. The blood supply to the bone ring comes now from the distal and the mesial part of bone and on from the bottom. And you see, the ring fits very well, very precisely. This is very important for the blood supply, for the revascularization.
That's an allograft ring here?
It's an allograft ring, yes.
And 7 millimeters, I think.
7 millimeter diameter, and inner diameter was 3.3 millimeter.
Mm-hmm.
And you receive from the lateral side, it's very important that the ring from the vertical position comes to the level from the bone next to the ring, to the adjacent teeth. Don't put the ring higher, because it gets resorbed exactly down to this position. Then we insert our implant through the ring into the local bone. The implant is on the right position, and then we fix a membrane and fill up this area with particulated bone graft material. This is our standard procedure. And before we do that, we remove, of course, sharp edges. Mm. And the X-ray follow-up, you see the translucency from the ring, the pins for fixing the membrane, and this is already 3 months later, and you see how the translucency changing, and it looks more like trabecular structured bone. This is typical for the allograft ring. This area is completely changing. 6 months later, you see it looks like normal trabecular structured bone. And this is a re-entry time, and you see the ring is, the silhouette of the ring is already visible, but it's changing completely. There are bleeding points, and you see this is living bone, and this ring is reorganized, revascularized in normal bone. Of course, there are some allograft particles remaining, but we find out that if we make a histological probe after 2 years, you will find only own bone. There are no more allograft particles left. With the gingiva former, you see we have a nice keratinized gingiva, and it looks very healthy around our implant. And this is a ceramic abutment. You see we have a very nice emergence profile, and this is a ceramic crown in position. And this is already 2 years after loading. You see we have a very stable bone formation and very healthy situation. This is a typical indication for the bone ring technique if you have a defect like that.
Thank you.
Do you have a question?
Yes. You say that soft tissue closure is one of the most important parts of the bone ring technique as well.